Okay, hello and welcome to Georgetown University's 25th Annual Pregnancy Resource Forum. My name is Carrie Ashkenazi and I am the president of Georgetown University Right to Life. We are thrilled to have with us today Joyce McCauley-Benner of Feminists for Life, Carol Day of Health Education Services, and Kelly Marcum of the Northwest Pregnancy Resource Center. But before I introduce each of them, I'd like to make a few logistical announcements. First, if you have not already, we ask that all audience members please mute yourself and turn off your camera. Once you have done so, navigate to the right uppermost corner of your icon and select Hide Non-Video Participants for the ability to focus your screens on our three panelists. Second, today's forum will be recorded for any viewers who are unable to attend or must leave early. The structure of the evening is as follows. We will begin with a 25-minute moderated discussion between our three panelists and will then transition to an open Q&A for the remaining 30 minutes. Please submit any questions to chooselife@georgetown.edu or by direct messaging me through Zoom. With that aside, thank you to all participants for joining us tonight for our 25th annual forum, an event started at Georgetown in 1996 to bring together students, administrators, and pro-life leaders in conversation about fostering a culture of life and supporting pregnant and parenting students, faculty, and staff on campus. This year marks the first time our forum has been conducted virtually, and in many ways is representative of our active and persisting efforts to adapt to the multifaceted, complex circumstances and challenges that women may confront surrounding pregnancy. We are so grateful to have you all here tonight as we learn about this important topic, all the more pressing in light of COVID-19. With that groundwork laid, I'd love to begin by introducing each of our guests. Carol Day is the Director of Health Education Services and an adjunct assistant professor in the School of Nursing and Health Sciences. She provides individual consultations directly to students in the areas of sexual health, nutrition, and pregnancy and parenting. Joyce McCauley-Benner is a Feminists for Life representative who has worked as a case manager, researcher, and legal advocate for vulnerable populations, including sex trafficking victims, domestic violence victims, and low-income families. She speaks from both personal and professional experience to help audiences understand the powerful connection between the exploitation of women and the exploitation of abortion. Joyce currently oversees a utility assistance program for low-income families, is a frequent contributor to Feminists for Life, the American Feminist, and has addressed poverty, violence, and exploitation during her presentations on college campuses, on Capitol Hill, and at international conferences. Last but not least, Kelly Marcum is the Development Director of the Northwest Pregnancy Resource Center. A volunteer at the center since 2012 and a Hoya alumna, she has worked as a lobbyist for pro-life legislation on Capitol Hill and as a journalist based in Boston. Her writing has been featured in The Federalist, The Washington Examiner, the National Catholic Register, and the American Conservative. Currently, she lives with her husband and two sons in Virginia. And with that, let's get started. Joyce, I'd like to turn to you first. For over 2 decades, Feminists for Life has been active in generating conversations about supporting pregnant and parenting students on college campuses across the country. What was the original impetus behind these pregnancy resource forums, and why are these conversations so important to continue having?
Thank you, Carrie. I'm delighted to be here at the 25th anniversary of the Pregnancy Resource Forum. So in 1996, Feminists for Life was sort of starting to have discussions and looking over some research that the Gallup poll had done in regards to students who at the high school level were identifying as pro-life. As they moved into the college level, they started gravitating more towards pro-choice. And so there was a lot of conversation happening at that time as to why was that happening? Was there something specific going on? Why the change? And one of the things that was raised was, when you got to college, where were all the visibly pregnant students? And a lot of campuses, you could look around, especially if we're talking about undergraduate students, no one could say they saw a visibly pregnant woman. They also, to be honest, didn't see a lot of visibly pregnant teachers or faculty as well. Not to mention, there was a board member at that time of Feminists for Life, and they were having a meeting in a basement and discussing, without housing, daycare, maternity coverage, those basic resources, why would I choose life? And so that question, I think, that the board member raised was sort of the impetus behind maybe we need to look at this issue a little bit differently. And so Feminists for Life at that time joined with Georgetown University's Right to Life, the group, the founding group, to start asking that on college campuses. And Georgetown became the first school that was sort of willing to start asking those questions. So we created the Pregnancy Resource Survey, which was the start of all those questions being asked. If I found myself pregnant on your college campus, what would I do? And we started just going through those original questions. Would there be housing? Would I get kicked out? Would I be able to finish my classes? What would I do about coverage, maternity coverage? How could I go to the doctor? Those are very tangible, basic questions. And I think a lot of times the abortion debate gets centered around theory. And instead, we wanted to bring it home to something that was very tangible and very practical for college students, and start exploring how each campus could actually make a huge difference by addressing those unmet needs one at a time. So that was kind of a little bit of the history. And Georgetown was sort of the first university that said, okay, we'll jump in and we'll do this together with you. And as FFL started it here in partnership with Georgetown, we then took it to other campuses across the country. Eventually, it became the model for today what it was the Pregnancy Assistance Fund, which was a federal funded program that has since ended. But so we used that model of taking those questions, allowing there to be discussion between pro-life leaders, students, and university administrators, and hosting and facilitating groups to discuss this, and then to make a blueprint, right? A blueprint for change. What can the university do that can address one of those issues? And that's how change could happen on campus.
Yeah, thank you so much. Carol, you do a tremendous amount of work on campus geared towards supporting and empowering students. Can you give an overview of the resources Georgetown offers to pregnant and parenting students at Georgetown, including how Georgetown is maintaining these resources in the era of COVID? And also, as Director of Health Education Services, what is your role in providing these resources?
Yeah, thank you. These are great questions. And I have to say, you know, Feminists for Life, we're responsible for us continuing to improve our resources for students back for the original forum that we had at Georgetown. The services are pretty broad. They are available to anyone who's a student. So I would say largely most of the resources go towards undergraduate students who are contemplating, you know, what is usually a crisis pregnancy, but that's not always the case. Sometimes people are very excited to be pregnant. We start by having outreach to campus, and I'll get to like how things have changed in just a minute or two. But we have outreach free pregnancy tests, and we have wrapped around the free pregnancy tests, which we give out to people without no names, no questions asked. We don't charge anything, hence the free, but that's easy access for people who might be worried about being pregnant and wondering what's available. So on the resource sheet that goes with the pregnancy test is like, here's some questions you might want to ask yourself now, and here's some resources, including there's a phone line that operates 10 a.m. to 10 p.m. You can phone or text questions to that. You can ask me off hours how to get a pregnancy test. We have them outside our office on the brick in a locked box with a combination. So if anyone needs a test, even after hours, they can get that. And we hope that that will provide just an entry point for a lot of students who might be worried, and we'll also let them know that here are some services and support that we can provide in case they are going to be, you know, having a baby while they're still attempting to be a student on campus. And we've had a lot of successful students that have done that. We have one place on campus, and they can stretch to at least as many as 3 places on campus where there's a townhouse and there's apartments on campus that are reserved for student moms and their kids. And basically the university will cover the cost of what would have been 4 students in a townhouse, and there's 2 moms and 2 kids. And the cost of the property for a student in terms of rent is the same as it would be if they were just a single, you know, student living in the property. And from time to time, we've used other locations on campus as well for that. We will help people find prenatal care if they're in need of that. We will help connect people to resources for daycare. We do have and have had Hoya kids on campus for daycare, but they don't start accepting children until they're a year and a half. So it depends on when the student is having the baby, whether or not, even if on the wait list, they might not stay a student long enough to take advantage of Hoya kids for babysitting services. And often what we found over time is students don't need full-time babysitting services. They can often patch together part-time, friends babysitting sometimes if there's a family member nearby, that's less common, but they'll find a way to work their schedule so that they can care for their child, mostly, with some support for that. We have found over time to, right to life volunteer babysitting services. And so that's something that students have taken advantage of because they need to still study at night. It's not like just they need daycare, they need evening care as well to maintain their schedule. Let's see, we have lactation centers on campus. We publicize those pretty widely on our website, Women's Center website. Title IX has a new website. We have a new website that talks about some of the services we do provide ongoing for people, but it starts with outreach, accessibility, and letting them know that this is possible, that they don't have to think about not having a child if they're pregnant, because we want to try to provide enough support. And that's consistent with our Georgetown mission as being a Catholic and Jesuit university as well. So I'll stop there and people can ask questions after a while. Oh, the question you asked about how are we doing COVID? I'm remote. Our whole office is remote. Most of the university is remote. We still have pregnancy tests in outside our office. If anyone, we have about 500 students living on campus. We have another 1,000 that live nearby. Right now, the box is empty. We've ordered new pregnancy tests. We'll continue to provide that service for the students that are around campus. And other than that, people can still seek services with me on a one-on-one basis. And I've been the primary person doing that with some help from staff, but it depends on who's on staff at the moment and who also has sort of the expertise to fill in and help students that are pregnant or parenting. So I'll stop there.
Thank you. Kelly, as Development Director of the Northwest Center, you help facilitate pregnancy and parenting support for mothers across the broader DC community. What are some of the resources the Northwest Center provides to new and expectant mothers? And more generally speaking, can you tell us a little bit more about what the Northwest Center is and what it does?
Yeah, so for some of you who may not know, the Northwest Center was actually founded by Georgetown students and alumni, I should say, in the basement of a church. Like many good nonprofits start in basements, apparently. And they basically realized that there was no pro-life resource for women in DC to go if they were pregnant. So they basically just started putting signs out on the metro saying pregnant need help. And women started flooding to this church basement where they would get, pregnancy tests and some material assistance. That has since turned into the Northwest Center, which is comprised of two programs, the Pregnancy Center and the Maternity Home. Our Pregnancy Center sees about 1,000 to 1,200 clients a year, and we basically assist anything from diapers. Every appointment they get diapers. We hand out about 58,000 diapers last year, so we do a lot of diapers. Kids go through a lot of them. And so we do material assistance, but we also check in on them. We do emotional support. It's all, with the exception of me, every other employee at Northwest Center is a social worker. So the social workers will meet with the client, check in on how they're doing, provide referrals for higher education, employment, child care, prenatal care. We are not medically licensed, so we can't provide medical care yet. And so that's generally what the Pregnancy Center does. And additionally, in recognition of the fact that once the baby comes, a lot of times that's when the real work begins. So the women will, they can stay in the program for up to 2.5 years. And if they have another child, and a lot of times it's families too. I don't want to, there's kind of this notion that you have the single young woman in trouble. A lot of times it's families that were doing okay, and then the dad lost the job right as the wife got pregnant. So there is that as well at the Pregnancy Center, that we provide assistance with parenting classes, breastfeeding classes, car seats, all of those things, kind of the whole spectrum of services. The maternity home offers housing for women who are homeless due to their pregnancy. So the boyfriend kicked them out, the parents kicked them out. unfortunately, a lot of our residents are victims of domestic violence. So, you know, the boyfriend threatened them to get an abortion. They came to us. And so they stay in our home for 18 months. So throughout whatever point of pregnancy they move in, and then for a full 18 months. And that allows them to get back on their feet, again, realizing that pregnancy is a big part of it, and our goal is healthy pregnancies and to help them through that. But there's a whole, you know, everything starts after that as well. There's a baby. So we have live-in resident managers who help the moms get the baby sleeping through the night. We help them, hook them up with jobs. We provide, you know, the staff will babysit for the kids. As a volunteer, I used to babysit for moms who were taking ESL classes at night. We work with a lot of the immigrant population in DC. So it offers kind of the full spectrum, and it's very tailored because it's small staff. We can meet individually with our maternity home residents to determine what they need. And so just like a typical, a great success story that we have is a girl who came, and she was 5 months pregnant, and her boyfriend had wanted her to get an abortion. She didn't want to. It was a very violent relationship. She got out. She knew she needed to get out for her baby. So she came to us, moved in, had her beautiful baby 4 months later. They are now, she has since graduated the program. They're living on their own. She works as a medical office assistant. She got that certification while she was in our program, and she's now taking night courses to be a registered nurse. And she's got this gorgeous little boy. So that's the mission of the center, is really to help these women, but also to make sure that they are empowered to find their own way. We're not trying to just hand them diapers and say, you know, good luck. The goal is that they will achieve self-sufficiency at the end of both programs, whether in the pregnancy or the maternity home. And yeah, so I think that's basically the gist of what we do. It's very comprehensive. And again, the goal is not just to help the women have healthy pregnancies, but to help them in the years beyond.
Yeah, that's wonderful. Thank you for the story too. Joyce, my next question is for you. One of the topics you've written and spoken on is how the exploitation of women and the exploitation of abortion are intertwined. You've also done work pertaining to racial justice and economic empowerment. How do or might race, socioeconomic status, or other factors impact a woman's access to these pregnancy resources? How can we work and push for more equity in access?
Right. So it's actually a really tough question. I should say it's an easy question with tough answers. I think in terms of when you're talking about how race and socioeconomic issues kind of collide with resources for pregnant and parenting women and families, a lot of it has to do with location. So while I'm not from the DC area and I can't speak directly to the neighborhood around Georgetown per se, I can tell you that based on what kind of neighborhood you live in, where you're at in life will drastically change what you're exposed to and what preconceived notions you have coming in. So for example, if I live in an area and there's no real opportunities for me within a radius, close by, but the local abortion clinic is down the street, maybe that's all I know, right? Or maybe I come from a neighborhood where there is a community center across the street and there are programs run out of that community center. And so all those different access can really change our mindsets when we go through a crisis, right? So I've worked with a lot of women that had no idea the amount of resources that are available, because not because they don't exist, but because literally there was no knowledge. Sometimes we call it like the hidden secrets, right? They'll be like, well, I didn't know I could get this program, or this program. So sometimes it's not a matter of there isn't help, it's that are you aware of the help that's out there? There's also the expectation, the cultural expectation. And a lot of that's going to change based on where you're at and based on what you've experienced. The intersection of racism and maternal health is huge. We know that maternal health outcomes for minority groups of women is worse than it is for white women. And so a lot of that has to do with, even if you get into the appropriate resources, what kind of prejudicial bias do those workers potentially have? And that's a very real thing. And again, that depends where you're at and what your community is. In terms of socioeconomic bias, that's a big deal. I'll give you a real quick personal story. When I became pregnant in college, and granted this was like 20 years ago, so things work a little bit differently now, but I got on WIC, I got on food stamps, right? So I would go to the grocery store, and back then WIC had these green coupons, and you would give it to the cashier, and she would like have to check off what food you got, and if you were getting the correct food, because you can only get certain types of food while you're on WIC. Well, this creates, like, everyone behind me in the grocery line got annoyed because it takes longer to check out, and like self-checkout wasn't yet a thing. Okay. So it just held up the line. And so then people started, just making comments, and I felt ashamed, right? And you would go out of there, and if you didn't grow up with that experience, right? So maybe you grew up middle class or upper class, and you've never known what it's like to live in poverty and get the shame from not only people on the street, but when you go into the welfare office and get shamed from them, like that's a lot of shame to take on. So I think people forget that living in poverty can really stress a woman out, right? Or anyone who's living in poverty. And when you compound that with racial bias as well, it becomes a very stressful thing to overcome. And then you couple that again with the neighborhood that you're in and what opportunities are around you. And again, we have to think about what's the closest thing to you, the abortion clinic or the community center that might offer more. So those are definite issues that compound and intersect, and they're not easily solved. Like, it's all these different issues that come into each other, and we have to kind of look at each one. It's a very complex layer.
Yeah, thank you so much, Joyce. Turning back to you, Kelly, from your perspective, what are some of the chief challenges COVID is posing for new and expecting mothers? What are the ways, oh, so sorry.
No, keep reading the question. I was just ready to go.
What are the ways that the Northwest Center is adapting to meet these challenges?
Right, so that's sort of two-prong. The Northwest Center has stayed open the entire time. I haven't been allowed in. My executive director banned me. I was also 8 months pregnant when this all started, so she was not about to let me anywhere near anybody. So it's a kind of a two-prong. So first of all, there's the economic fallout of COVID. Obviously has affected our families. And so we continued our material assistance. There would be, we basically did curbside pickup with masks and gloves and all of that, because the material assistance and the economic distress is even more pronounced than it was. The need has even increased. So today I was driving into DC, and I got a phone call from the Planned Parenthood over on 4th Street. They did not call me. The sidewalk counselors outside of the Planned Parenthood called me because they had some women who were about to walk through those doors because they felt they had no option economically. And so they got us on the phone, and they got Capitol Hill Pregnancy Center to take care of those women. So that's just kind of an example that these women, I didn't speak to them, so I don't know what their thoughts were at that time, but it was very much a financial stress situation that had brought them there. And like Joyce said, it's easier to get to those places. Sometimes they're very good at building in neighborhoods where the economic stress is higher. So we have worked really hard throughout COVID to try to counteract that as much as we can. Unfortunately, the sidewalk counselors are still doing their thing. And then on the other side, there's also an advocacy piece. And I wouldn't know as much about this if I hadn't actually been pregnant and having my baby during all this. But because everyone was so stressed, rightfully concerned about the health concerns of COVID, a lot of prenatal care fell through the gaps. Joyce mentioned the racial disparity in maternal health outcomes. We do work primarily with Hispanic and Black women at the Pregnancy Center Maternity Home, and they have up to 5 times the rate of their white counterparts in terms of mental health or maternal health complications and infant health complications. And that can be regardless of socioeconomic status. It's just the racial bias that they experience. So we already have a huge advocacy piece in place at the center. We have pro bono lawyers. A lot of our volunteers happen to be lawyers. They come in and talk to women about what their rights are in the hospital, what they can demand. So we tailored that a bit for COVID. So there was a lot of policies in place for hospitals. You weren't allowed to have, some hospitals in New York, we didn't have this issue here, wouldn't allow a support person in with a woman in labor, which is horrible for childbirth outcomes. And so fortunately that was repealed. Virginia never got that draconian, but they were doing tests, and they were having forced separation of the baby if the mom was positive, even though there was kind of conflicting. So there was all these different policies going on, and like I was faced, and I, can advocate for myself well, but so we had some lawyers come in and meet with our pregnant moms in the maternity home and do draft language for them so they could waive separation from the baby. Because a lot of the hospitals, they tried to pressure me. They're like, well, we don't want to maintain a 6-foot distance. It's very difficult for our staff to have to do that. So we'll just put the baby in isolation, which is terrible for the baby. So I, was like, absolutely not. But a lot of our clients, English isn't their first language. They don't, they wouldn't necessarily know to advocate for that, or know that they could advocate and waive those and have, when you're a patient, you're the boss. You run the show, particularly when you're in labor. So we had pro bono lawyers come in to work with patients so they could advocate for themselves in the hospital. And also for prenatal care, we had a lot of prenatal care appointments were being canceled, and which is okay if you're a low risk pregnancy, but we had some higher risk pregnancies in the maternity home at the time. So we had volunteers for our medical personnel come so that we could monitor the women's blood pressure from the maternity home. We could kind of monitor their vitals along the way, since they weren't getting that in-person care that they normally would get.
Thank you for your answer, and congratulations also for your family. To follow up on that, Carol, do you think social distancing is going to affect how people access potential resources? What more can we do, 1, as peers and friends, 2, as a club, and 3, as a university, to support pregnant and parenting students who we encounter?
Sorry. Great question. Thank you for that. We had, in conjunction with Right to Life, we have stickers in the bathrooms. I think this was the year we were going to replenish them, but no one's around now. So we could still look towards like maybe redesigning and getting those ready to go for when we have students back on campus. We don't now know. I can tell you that it's sort of planned a little bit that we might have 2,000 students in the spring. It's not been decided, but that's a little bit what I know about like what we hope to do. And we will have 2,000 students of whichever sort, I don't know. Right now we have 500 students on campus, but I think to plan ahead for like stickers in places, because that's been a great, again, another outreach effort where there's information. Here's our office, here's connection to the website, here's how to get a pregnancy test. I think the more we can do social media for letting students know we have resources. I know right now I'm teaching 4 classes. I have probably over 100 students in those classes, and they're all sort of overwhelmed with like, we don't know where to go for things, including mental health resources, health resources. I think they're so bundled and they're there, but people have to pay attention to what they get by email. So we need to get students information in sort of real time in ways that they're looking at social media. And what are they following? Instagram Live. So maybe something like that. We are just, as an office, beginning again to do more social media, because it was sort of not the channel we used primarily when we were mostly on campus and we had access to students to do outreach programs and a lot of things, trainings, education. Then when we went remote in the spring, we realized we didn't have a very strong following for social media because we hadn't been using it that much. And then we built it up again. Then the summer we didn't have students. We used all students as partners in the work that we do for health education, because we want to make sure our messages are relevant and they're getting to students in a way that students would find acceptable. So right now we're building back up our social media. This could be another, infographic. I have access to a graphic designer who can help do things, and we need more information out. We still have exactly the same services that we're providing to people, to students, and I don't know how much they know about that, but we're remote. pregnancy tests are still, you can get either on or off campus. If you're close by, you can stop by the box and pick up a pregnancy kit. But I think right now it's hard to know, especially new students, because they have never been to campus, lived on campus. They don't have the same connection. So I would network with maybe the different, freshman groups and ways you can continue to try to build the members in your group, and co-sponsor with other partners that might have, also opportunities, things to reach out to students about and get messages out there about the kind of things we do have for students. And then social distancing, I don't know. I mean, right now we worry because students might be living at home with someone who is not a safe person for them to live with, or they might be in an unhealthy relationship. So how to reach students and let them know that they can still reach out and talk to people, they can still reach out and access the same services when they're in a space that might not be the best for them. Don't know how to convey those messages, but we are here for students, and absolutely everything is confidential, private by law. So anyone can reach out and talk to us about things they might be experiencing. I wonder too if there's some way to network for where students are staying now in terms of their states. Is that a way you can reach out? If you can get those designations, like what state are they living in, and maybe you can bundle some resources for them that are also specific to the state, whether it's relationship violence or problematic. I know there's increased incidence of that now, but there's less reporting because people don't feel like they can do that safely. So maybe bundle those two together and reach students by state. Hopefully they'll leave the state they're living in and come to campus, but they can access our services anytime, no matter where they're living.
Yeah, those are great ideas. Thank you. Joyce, speaking from your personal experience or from the experiences you have guided others through, what are some of the biggest obstacles to supporting pregnant and parenting students on campus? Where do you think there is room for growth, either in general or at Georgetown more specifically?
So I think Carol kind of highlighted some of the challenges of getting the word out. I think that Georgetown, as well as many other universities, I think there are good resources available, and the question becomes, how do we get the word out? I think that's number one. Number two is, the bigger challenge, in my opinion, is how do you change the culture of not, when you find out you're in a crisis pregnancy, where is that default mindset going? And a lot of people, that default mindset becomes, oh my gosh, this crisis is too overwhelming, as particularly when America is in a crisis as well. So like there's a national crisis and then there's a personal crisis going on. And so the default becomes, I can't handle this. How do I stop the crisis? So I think the challenge becomes not so much about, I think we've conquered the first challenge, which was offering support. I think that we've got the tools to support women. The second question becomes, how do we convince them to access those tools? How do we convince them to believe that I can do this, to have that sense of empowerment that I can be okay. I can find a way to meet this challenge. So I think that default mindset is one of the hardest things on college campuses. And that goes back to our original question from 1996, which is, where have all the visibly pregnant students gone? I'll ask your generation today. We asked it 25 years ago. I'm going to ask your generation again today. Do you see, right now, of course, with the COVID, I know you're not really on campus, but even last semester, the semester before that, how many visibly pregnant students are walking around campus? I'm guessing still not very many. And so that default mindset becomes, well, I don't want to be the first one. I don't want to be shamed. I don't want, and then you also have, there's not a lot of faculty either, you're affected by that mindset of, can I really do this? So I think those are some of the ongoing challenges. Some of the more practical challenges, I think childcare has always been an issue, more specifically infant care. I don't care where you live or where you go to school, that's a challenge. Infant care is expensive. It's also difficult to find. And in the university environments, typically you'll find that faculty or graduate level students might have access first to the wait list and before the undergrads do. So that childcare, I think, has always kind of been, that's a challenge whether you're a college student in parenting or whether you're just parenting in general. And then you add the COVID on top of it, and childcare continues to be, you know, a huge challenge for people. So I would think, practically speaking, that's still kind of an issue. But I think on the positive side, we've come so far in terms of women being able to access remote learning, being able to stay at home, care for their children, and continue their degree. I mean, the academic resources and being able to do this online and to record different lectures so you can come back because maybe your child interrupted you for a moment, you know, but it's being recorded so you can go back, and like those kinds of things, that we've come so far. And I think that women are like, okay, I can definitely get my education and stay on track. So I think it goes back to the financial concerns. A lot of, you know, Kelly had mentioned that, you know, especially during COVID, how am I going to pay my bills? How am I going to pay my electric bill? How am I going to get enough diapers? So I think those are some of the ongoing concerns that really haven't changed over time. But ultimately, we've made a lot of progress in 25 years. And I think now that challenge becomes just embracing it and getting the mindset to, the default mindset to be, I can do this, instead of this is too overwhelming. Right.
Yeah, thank you for that thoughtful answer. So now I'd like to transition to the Q&A portion of this forum. If everyone could please turn back on their cameras, that would be lovely, so we can return to more of a traditional forum format. Again, please continue to send your questions to chooselife@georgetown.edu or through direct message to me in the chat. Please indicate if you would like your question to be asked anonymously. If not, I will ask you to unmute yourself to ask your question. As people are sending in questions, I have 2 preliminary questions for all the panelists. So most undergraduates at Georgetown have not experienced childbirth or parenthood, yet care deeply about the sanctity of human life and desire to help empower our friends and peers who have or are. How can we grow in empathizing with and actively reaching out to peers who may be experiencing feelings and challenges that are foreign to us? How can we be sensitive in connecting peers with resources while remaining vigilant to avoid any kind of savior complex or merely performative allyship?
Is that for anyone?
Yes, if you could answer that, that'd be great.
Well, I know, I think the biggest way to do that is to build relationships. I think that relationships and connection, and remembering that the more we get to know people, the more we learn, the more we connect with each other. And I think once you have connection with another person, then you can kind of have respect, and then you can enter into authentic discussion. So I think it's important not to, if you don't know the person at all, to kind of jump in and be like, oh, I can help you, because they're going to be like, who are you, right? So I think the idea that just getting to know a diverse group of people and, you know, being welcoming and non-judgmental, and recognizing that everybody comes to this point in their life with different experiences, and to always remember the humanity within the people we talk to. And I know that's hard, especially right now, because we're so divided. And so we're constantly wanting to be like, oh, well, you think this, so you must be ... whatever. So I think it's important to just allow people to be, which means to kind of meet them where they're at. And I think the more we just get to know each other, when you're authentic and you make that connection, I think that's when you can really change people's hearts and minds.
I would agree with that. It starts with the relationship, and if you know need to know, and it comes from authentic talk and asking what they need. There's a different phase of pregnancy or parenting, like, what do they need? Don't ignore people. If they're parenting a small child at Georgetown, there are people like that. Get to know somebody if you see them with a child, or even faculty, pushing a stroller. You never know who you might be able to help by just engaging a little bit. But your deep friends, those are the people you want to have the serious conversations with, and just say, how are you feeling? How are you doing? How can I help?
I think there's also, to build upon what Joyce and Carol said, kind of a two-pronged approach. That one thing was, the side and support of life, the defensive dignity of life, it can be daunting, but it's also inherently joyful. Babies are inherently joyful. They're a good thing. They're never not a good thing. They may be not in our time, in our perfect plan, but when they arrive, but they're always a good thing. So the side defending life and the sanctity of life is always going to be, should always be more joyful because of that. And so that goes into what Joyce was saying about welcoming. When I was at Georgetown, and obviously you can't do this now with everything, but with tabling, there would be so many people who come up to us, who maybe didn't agree with us on where we stood, but they always appreciated the joy that emanated from our table. Also probably the baked goods that emanated as well. But it was a welcoming place, because it was a movement that was based on love and based on joy. So that was kind of the attitude that we carried with us. Even to the point I was running a Right to Life event one time, and a woman came up to me, and her daughter was pregnant. They were visiting campus for another event. She wasn't a student, and she needed to know if ibuprofen or Tylenol could be taken while she was pregnant. She couldn't remember. And she just came because she saw that we were like happy and we loved babies. So she figured one of us would know if she could have ibuprofen or Tylenol. So that's just kind of an anecdote. But the other approach, in terms of once you've developed that relationship and is someone who might need help, and this is something that the social workers I work with are far better at than I am, is not self-disclosing. Because once you try to say, oh, me too, with them, and stop listening, you automatically turn the narrative about you instead of about what they're struggling with, what their goals are, and what they need. So I've sat in on a lot of counseling sessions as part of my job with the social workers. And that's something that I always marvel that they do, is that I know they could probably, swap stories with these women. And sometimes that's the appropriate place when you're building a relationship. But when you are actually trying to be a resource for somebody, then it's not about you. It's not about how you can, relate to this one thing. It's about listening to them. And I think once you get that mindset, then you're automatically not going to be being performative or savior complex, because you're going to genuinely want to help.
Thank you.
Can I just add one quick thing? Kelly, thank you for that, because one of my favorite quotes that was told to me was, every person experiencing unplanned pregnancy also deserves to experience unplanned joy. And so the idea becomes, everybody thinks unplanned pregnancies are like the worst and the hardest thing to get through. And, there's all this like gloom and doom when we're talking about when people find out initially that they're pregnant and they're worried, and we forget the joy in it. And just because it's unplanned doesn't mean that there's not joy in the process. So Kelly's story just reminded me of that quote, that they also deserve unplanned joy.
I love that. I haven't heard that. So one other question for all three panelists. What is it that got you into this work? And what is it that keeps you active in your efforts to support and empower others?
I can go. So when I was 10, the Partial Birth Abortion Ban Act was moving its way through Congress for the third time. For those of you unfamiliar, the Partial Birth Abortion Ban Act bans exactly what it describes. And it made it through Congress twice in the 90s and was vetoed in 96 and 97 by then President Clinton. It made it through again in the early 2000s, and President Bush signed it into law, and then it worked its way through the court and then was upheld in the Supreme Court in 2007. I remember seeing an ad for it, and I was 10 at the time, and I'm one of 9, so I don't know who my mom was pregnant with at the time, but I had been to a lot of doctor's appointments and ultrasounds. And so I asked my mom what the commercial was about. And so my mom, faced with, and now as a parent, I'm like, this must have been a horrifying moment for her when her 10-year-old little girl is like, what's going on? And so she, explained to me that, what abortion was. Obviously, she used terms appropriate for a 10-year-old. And she explained to me that, some people view that as an option for a pregnancy. And that was just earth-shattering to me because, again, she was probably pregnant at the time. And I grew up listening to field Dopplers and all of that. So to me, it was always a very distinct, separate human being from a very science perspective. I didn't know Catholic social teaching at that point, outside of my little second grade preparation for First Communion. And so she told me that there was a law that allowed it called Roe v. Wade, and she did not get into the Supreme Court with me, but I just said I would fix it. I told her, I was very confident. I was like, Mom, I'll fix it. And she was like, okay. But so that's how I got started. And so I started speaking at rallies when I was 14, was involved at Georgetown, and was a lobbyist for pro-life legislation on Capitol Hill in 2000. I worked for a policy organization from 2017 to 2018 when I got pregnant. And now I work here. But it's the babies that keep me going. Sorry, I forgot that part of the question. It's the protecting innocent life. And that only is deepened with the birth of my 2 sons.
Well, for me, it's probably a personal experience. I found Feminists for Life because 12 years ago, that's when I first had joined Feminists for Life. I had heard about it through a friend, and she told me about this great organization where you can be a feminist and you can also be pro-life. And I thought that was mind-blowing at the time. I thought I was the only person that was like that. And so the idea that there were other people that thought that way was just amazing to me. So at the time I joined Feminists for Life, and they had a call out and said, hey, if anyone has a story about a particular pregnancy that was unplanned and you want to share it with us, go ahead. I had never shared my personal story at that time. So I had only told my closest friends and family, nobody knew about it. And basically when I was in college, I was working at a restaurant, and one night I was being sexually harassed, and by the end of the night I had been raped. And shortly after that, I had found out that I was pregnant. So I didn't know if the pregnancy was a result of the workplace rape or the relationship I was in at the time. And through the 9 months that I was pregnant, I decided that I would carry to term and I would have my son, because it took a long time, but basically I dug down deep inside and decided that there was as much of me inside this child as there was the rapist or my boyfriend. So I had my baby boy, and it would take months before I would learn who the father was. But at that point, it didn't matter to me as much anymore, because I learned to connect with my son and the part of my son that was me. So that was the gist of my story. And I had shared it with Feminists for Life. And at the time, I remember writing it down for the first time and sending it off to them, and then immediately being like, oh my gosh, I want to take that back. Because to me, it was just my life. There was nothing extraordinary about it in my head at the time. So I sent it off, and I didn't think anyone would want to read it or anything like that. And then 2 weeks later, I get a call from one of the workers at the time who worked for FFL. And she said, hey, do you want to come and meet us and think about sharing your story publicly with Feminists for Life? And I was like, what? You mean there's people that might want to hear this? So I did, and here we are. And I will tell you that that was the start of my healing journey. Just being able to share hope and empowerment and travel the country and talk to so many collegians across the United States and elsewhere, and being able to tell them a happy ending and a good ending, and just share that, that became really powerful to me, and it became really healing. And so that's kind of what keeps me going and the reason why I do this. So
thank you so much.
Okay. Well, and I'll jump in here and say, I think the reason I'm doing this work is multifaceted. it's an intersection of lots of different things I've done over my career. And I think, and some of this is retrospectively, you know, how did I get where I was? And I've had sort of a calling for a long time, I think, to be sort of a healing person and a health professional. And that's how I got to be a nurse, and then went for a master's degree in nursing. And some of the joyful things I did while I was doing more hospital-based work was labor and delivery. I thought that was just wonderful, fabulous. If someone lost a pregnancy because it didn't go well, that was the saddest day for these people that I was trying to help through a journey. It was also hard for health professionals to do that. I had sort of an experience as an early graduate from nursing, where I was at a hospital where they allowed abortions, and I had a particularly difficult situation with a doctor who said, you know, it's a first term abortion, and it wasn't. And that was a jarring experience I had, and sort of solidified my feelings. And I think that I want to be present for people. If in moments of crisis, I've done a lot of crisis work. I do a lot of crisis work still. I teach crisis. And I know that people have a hard time making decisions when they're in crisis. But sometimes it's having to be there with someone. It's a gift to be able to help them see the possibilities. It's a moment in time that might be overwhelmed, that might be temporarily feeling like they're paralyzed, or they have only one option. When you say, here's some possibilities, and here's ways that university could help, or I could help with them, and just go one step at a time, one day at a time. And in my own life, you know, happiest days of my life when I had each of my 2 children, and the day my granddaughter was born. So it's wonderful to be able to be present with people, to help them along the way, and try to give, especially young people, young women, some context and some vision for what the possibilities might be.
Thank you so much. Those are all very powerful stories. One question that's been asked anonymously is, I am a man, what can I do? Should I just step away?
No, don't do that. Men have an innate duty to protect. And I think the pro-life movement needs men well, first of all, it takes 2 to make a baby. So the man was involved at some point. So step up. I'm not calling out anonymous person, but I am saying that men have a duty to set examples, either for their peers, if they're not in that situation. But men have a duty to defend the weak and the vulnerable. And there's nothing more vulnerable than an unborn child or a woman in crisis. At the center, we see men all the time who are unfortunately shirking that duty and have left the women to be alone. So I have always believed that, you know, the pro-life movement it's a pressing issue, and you shouldn't stay neutral just because you can't physically get pregnant. There is still the death of innocence happening, and so it is your moral obligation to step in and stand up for that. But at the same time, do it compassionately, do it with understanding, and do recognize that there is only so far that you can empathize with a pregnant woman. And that's true, you know, for the male OBGYN, the male pro-life guy, all of them. So, but definitely do not step away, and do not step out of the way.
And definitely, as somebody who's experienced sexual assault, I will tell you that when I started with FFL and started traveling the country and sharing my story, just to see the amount of pro-life men, or even men who just were sympathetic, right? Like regardless of their stance on any issue, the fact that there was men out there who wanted to help and who wanted to say, hey, that's not right, what you went through, that was hugely healing to me. So being able to talk to men and say, you know, you have so much power because you can speak to other men, and men can influence other men very strongly, particularly on college campuses, in locker rooms, in dorm rooms, and all those places where male conversations are happening. I mean, just to be able to be the model that says, I'm not going to exploit women, I'm not going to make rape jokes, I'm not going to, you know, do those things, and encouraging their friends to do the same is huge. So we've always said as FFL, men are welcome in this movement. We need them in this movement. This is a humanity issue, right? And it's not about men are bad. It is about, you know, we are all in this together, and we need that. We need men to step up, like she said, and be there for both. And you have rights and you have responsibilities. And I think the more we push that away, we lose sight of that. So I definitely agree that men are needed in this movement, and they should be welcomed.
Thank you.
I think it might also be worth pointing out that men can also be victims of abortion. You know, I know men who did not want the girlfriend to have the abortion, or maybe they didn't even know she was pregnant. They found out after the fact, and they would have done anything to support her. So men also can be victimized by abortion as well. So I just wanted to mention that real quickly, because I do think that sometimes gets overlooked.
Mm-hmm. We have one question by Reggie. Would you like to unmute yourself?
Yeah, I wanted to ask, like, as a Georgetown student, like, I've been all around DC and I've explored DC, and I even lived in some low-income parts of DC, like Southeast and in Prince George's County, and I just found a lacking health, system. I mean, it just doesn't exist. I mean, it's like a health desert. What steps are really being taken to improve access with probably the most vulnerable populations in the DMV area?
Well, I can speak to that in terms of, so our center works predominantly with those people you just mentioned, the people coming from those neighborhoods. And you're right, it is difficult. And, you know, just one glaring, our maternity home is the only place of pregnant women without other children can get housing in the DC, within DC city limits before her 7th month of pregnancy. So imagine living in your car up to the 7th month of pregnancy. That's not feasible. So you're right. You're absolutely correct in that there is a massive loss of options. We do not do an extensive amount of, we'll do policy advocacy, but we have to be careful. We're a nonprofit, and we're not a political nonprofit, so we have to be a little bit careful. But there are, basically what we have found to be most effective is developing community partnerships. So in your work with nonprofits, you'll notice that they all partner with other people. We refer to the childcare place down the street. We refer to Mary Center, which is provides medical care. So the community partnerships are really, and that's something that they're not necessarily listed on the DC government health department. So you won't necessarily see them or know about them, but those are really the lifeblood of the services that can be provided for a lot of the lower income populations in the city. But no, you are absolutely right that there is much more work to be done. And that's something that we try to do. We connect women with government resources as they're available. We connect them with their insurance that they can qualify for, all of that. And that's being done by pregnancy centers and nonprofits around the city. But there's always more work and there's always more need. So I'm sorry I can't give a more hopeful answer.
I think get involved, stay involved. There's a Hoya clinic that Georgetown runs. And I would, just continue to, work with the Northwest Pregnancy Center, educate yourself, look at Feminists for Life. There's a lot of information they have on the website. Maybe volunteer, be an intern somewhere, someplace where you might be an atypical, person to be involved, just due to perhaps your, what I look to be obviously male gender, but get involved. We need strong men all over the place, and we need more information and more people doing lots of things, because there's going to be even a greater need than there's ever been because of the health inequities, because of the COVID, because people have lost their health insurance. And I hope the election goes the way it's going to go, but we continue to support access to health care for people, because it's going to be very important to do that. So, do the best you can and talk to people who are already interested and involved.
So one thing, Feminists for Life, we are a national organization, so we're not localized in the sense that I could speak directly to that neighborhood. But in general, like everyone has said, community partnerships are probably the most powerful thing out there. But one thing we did as Feminists for Life, particularly during COVID and how it's affected everyone across the United States, is we've created a few years back a website called womendeservebetter.com. And if you check out that website, there's plenty of articles that talk about various aspects. So there's work-related ones, relationship-related ones, support, and then live, just figuring out how do I get my daily needs met, right? So that was kind of our contribution. And if you go to womendeservebetter.com, it'll take you to all these helpful articles and other national resources. And by clicking on those, you might get then to learn more about more local communities. So that was kind of our contribution in terms of, as a national organization, what can we do? Well, we can connect people and we can show you from a national perspective what's going on, because maybe you'll see something else and then be like, oh, well, maybe that'll work in my local area, or if this area has it, maybe my local area has it. So that is something too that we want to spread the word about. And as college students, wherever you guys may go, when you graduate, please take that with you and know that, at the click of a button, you could get to a website that would talk about those things. And the nice thing about womendeservebetter.com is it's completely abortion neutral. So it's not going to start a debate or an argument with your friends or whatever. It literally is just a resource to find out, well, for example, maybe you are in need of housing. Like maybe you come across a person and so you click on, how do I find housing? Because maybe you have no idea. And so even our just national tips might take you to some local tips. So that was kind of our contribution to that.
Thank you all. I really want to be respectful of everyone's time, so I just have two very quick last questions. One is, how can we contact you and or learn more about the resources you or your organization are able to provide? So if you have like a link, feel free to drop that in the chat or just say it out loud. And then the second question is, can you each speak to one tangible action we as college students can take in response to what we've heard and discussed today?
Well, definitely, like I said, check out womendeservebetter.com. Please share and spread that. Spread it on your social media, get it out there. So that's one very tangible thing you can do. Go to feministsforlife.org, which is our actual agency website, and please become a Feminist for Life and join us and get on our email list, see where we're going to be, and help bring us to your campus, whether virtually or online. I'm happy to share my story. So, and also to spread the word about what we do with the pregnancy resource forums. So definitely feministsforlife.org. Check us out on Facebook or Instagram, and as well as womendeservebetter.com.
And do as much as you can with the organization for Georgetown. Talk to friends, tell them what you just learned, pass it along. It's not debatable. This is a great idea. It always has been. We need more people who recognize like this is something that's entirely something to be educated about and something to be supportive about. And we're all in this together. And I hope that with COVID and all the downside that there is present now, that people have begun to appreciate the beauty of people and the quality of being in a family. And maybe going back to some simpler values, because this is something we can all support.
Our website's northwestcenter.org, and my email is in the chat. If anyone wants to contact me directly, all of the contact information is also listed on the website. In regards to what I think, Carrie, or one of the questions that was sent to me separately was about, how can current Hoyas engage, and kind of speaking as a Hoya alumna, since Carol and Joyce can definitely speak more to like this particular resource forum and what to do with that. I think as a group, it's not always the most in vogue issue of the day to stand for the unborn. And I do think that there can be a tendency to dilute it somewhat. To kind of group in other issues with it and kind of pile everything under the pro-life umbrella. And so I would just urge throughout your years at Georgetown to remember that the mission is to protect the babies and to protect the women who might find themselves in those situations, and not to kind of morally equivocate it with other issues but stay focused on your mission is, I think, what would lead to the most efficacy in terms of getting the message out and helping women and helping save babies and helping, save women from making a choice that they might regret. And I say save very loosely there. I don't want to say saving in terms of, you know, any kind of harmful manner. But I would say that as a group to keep your mission focused and not risk broadening it out to such a degree that you lose sight of that. So that would just be what I would say. Because if they know what you stand for, then they know who they can reach out to for help.
Thank you all. Thank you so much. At this time, if we were in person, we would all applaud you, but please join me, everyone, in thanking our amazing panelists. And thank you all for your questions, for all the work that went into planning this. I'm just really grateful that even though it's virtual, we were able to have it. And most likely we'll be able to get it online too, so that future Hoyas will have access to this important conversation. So with that, I'd like to conclude tonight. I will stay around if there are any questions, but please just join me in thanking our amazing panelists. And have a great night. Stay healthy.
Thanks for having us.
Thank you, Carrie.